Hello and Assalamu alaikum. Ultrascan Diagnostics. So this is the CBCT of the patient that you have requested. The area of interest is the upper left 4, the upper right 3, the lower left 6, and the lower right 5, 6 region. The information needed is for dental implants. So starting with the upper left 4 region, as you can very clearly see on the transaxial view, we've got a BDR, endodontically treated BDR right here. We've got very thin ridge. Um, we've got very thin buccal cortical plate, but the ridge width in this region is 7 millimeters of ridge width with approximately 14 millimeters of height. We only have very limited bone at the apex or intermediate, and we've got a periapical radiolucency causing a fenestration in the buccal cortical plate, which is a perforation. Moving to the lower left 6, which is right here, as you can also clearly see, the lower left 6 is grossly carious and infected. It has a crown restoration, but in the interradicular area you can see we've got a significant periodontal infection involving both the roots. So if this tooth is to be extracted, this is the mesial root. You can see the periodontal disease here, and then you can see a radiolucency associated with the distal root as well. Generally speaking, in the middle of the ridge, we've got a approximate ridge width of 11 millimeters and a height of 12 millimeters to the inferior alveolar nerve. The bone quality around this infected or inflamed tooth is D1. Now moving to the lower right 5, this is the lower right 5. Here we've got D2 quality bone. We've got a thin ridge at the tip of the crest, but if we move approximately 4 millimeters below, we've got a ridge width of approximately 5.8 millimeters and a width of 13 millimeters and a length of 13 millimeters. And you can even go deeper. This hair has D2 quality bone. Moving to the region of the 6, here we have slightly better bone dimensions. We've got again D1 to D2 quality bone, 7 millimeters of ridge width with approximately 12 millimeters of height. And in the region of the 7, the mesial root definitely shows some form of radiolucency. It could be periodontal disease or due to occlusal trauma. We do see PDL widening right here. And if this tooth is to be extracted for any reason, the ridge width at the furcation area is approximately 9 millimeters of ridge width with 15 millimeters of height and good D1 to D2 quality bone. If you would like us to place implants for you, please let us know what implant brand you are using, and we will place virtual implants for you as well. Thank you very much.